Good morning. My name is Jenny Perkle. I'm the statewide healthcare organizer for Maine People's Alliance. There are many problems with our healthcare system which are causing our human right to healthcare to be denied. Today you will hear stories that highlight some of these problems from people in our community who are struggling to survive in a healthcare system that is designed to benefit only a few. The stories you will hear represent the stories of millions of other people. 45,000 people die every year due to denial for their human right to healthcare in the USA. There are currently 50 million people in the United States who do not have health insurance, and more than 130,000 people in Maine. Many more people are underinsured. They have coverage that pays for emergency care only, or have coverage that has such a high deductible that accessing preventative care is unaffordable. Even people with good insurance are seeing their costs go up every year. Working no longer means that you will have access to health care. Only 44% of Maine employers offer health insurance. Union workers are bargaining just to hold on to their insurance at the expense of negotiating better wages and working conditions. And small to medium business owners are having to make the impossible decision to stop covering their employees due to rising costs. The U.S. spends 2.5 times more than most developed nations in the world, costing us 17.6% of our GDP. Medical debt is the #1 cause of bankruptcy in our country, and in 2012, 1,831 Maine people filed for bankruptcy due to medical bills. And with all of this, we are not even healthier for it. Our outcomes and quality of care rank among the lowest of similar countries. We have less physicians per person than most other countries, and our life expectancy is lower. While healthcare has been getting a lot of attention in recent years and steps have been made to improve the situation, it is not enough. Our right to the care we need to live full and healthy lives is still being denied. We are here today to find a solution. We stand with the Maine AFL-CIO and the Maine State Nurses Association with support from other groups such as the Southern Maine Worker Center and Maine All Care to announce the launch of the Maine Healthcare is a Human Right campaign. This campaign will focus on grassroots outreach and work towards a healthcare system that follows the human rights principles of universality, equity, participation, accountability, and transparency. A system that will allow Maine people to not only have access to high-quality care, but to also have a voice in how that system is run. Now I'm going to turn it over to 3 folks from the community who have stories about the current healthcare system.
Good morning. My name is Marie Pinio. Just last week, I moved to Yarmouth from Bangor. Our current healthcare system is denying my right to healthcare, my human right to healthcare. I have a heart condition that does not allow me to work full-time hours, which means I cannot hope to get lucky by finding one of the few jobs that offers health insurance. Last year, I made $7,000 working my seasonal part-time job, not nearly enough to cover our basic needs in health insurance. Due to the cuts made to Maine Care, my family is losing very much needed services and medical care. We need a system that would allow all Maine people to live without fear of losing their human right to health care. I have never before been in the position where I'm faced with choosing between gas in my car to get us where we need to go in this rural state and paying medical and utility bills. Deciding between whether to pay a bill or to get medication that I need to be healthy is not a decision anyone should have to make. As of the 1st of this month, I am no longer eligible for Maine Care services. I am hopeful that our legislature and governor will do the right thing and accept the federal funding so that my family and 70,000 other Mainers like us can get the care we need. But we need to do more to make sure that no one else is left behind. Unfortunately, my story is not unique. There are tens of thousands of people in Maine who are unable to afford health insurance. We are scared, we are stressed, which only leads to more health problems. Healthcare is a human right. It is a matter of life and death, and we cannot afford to deny care anymore. Thank you.
Thanks, Marie.
Hi, my name is Natalie Owens. I am currently living in Scarborough, and I am a native Mainer. I am in my late 20s and living without health insurance. Since I graduated from UMaine Orono in 2007, I have worked in social services both with youth and adults struggling with mental health and substance abuse. As a result of constant budget cuts, I was laid off from 2 agencies, and the third couldn't offer me full-time work. Like many people my age, I am trying to find my place in our society, find a career path that would provide me with financial security. My family has a history of both mental and physical health conditions that are proven to be better managed with early detection. I recently learned that my mom and aunts were all diagnosed with osteoporosis while in their 40s. Additionally, my aunts are breast cancer survivors, having both had double mastectomies. Neither breast cancer nor osteoporosis can be completely prevented, but with access to adequate healthcare services and early detection, the personal and financial implications of these diseases could be significantly minimized. I have not been able to afford a checkup since learning of the extent of my family history with these hereditary health conditions. My doctor is very concerned that the cost of health care is keeping me away from medical services that could save my life, or at the very least, minimize these the effects of these debilitating genetic illnesses. Because of the nature of social services, I am trying to find a career that fits me. The longest stretch I have had health insurance since graduating in 2007 has been 7 months. Even without insurance, I continue to be very proactive in my health care. I have been paying out of pocket for as much care as I can afford. Just last week, I was experiencing a bad side effect from one of my medications to control a genetic thyroid issue. Because I can't afford to meet with my doctor, we have been trying to manage my symptoms over the phone. This second-class service is a violation of my human right and is not effective. The high cost of health care, along with the lack of affordable comprehensive insurance, means that medical services I need to thrive and continue being a successful, productive member of society are inaccessible. This is a denial of my human right to health care. I am excited to be a part of this campaign to provide all my fellow Mainers with access to health care services they need. Thank you.
Thanks, Natalie.
Morning. My name's Jim Willis. I'm a resident of Cape Elizabeth. Used to be the HR director for a fairly large not-for-profit organization. I worked there for 7.5 years, 3 of which I was the department director. We offered health care to all of our employees at the beginning. However, that changed over time. In my position as HR director, I saw firsthand how our healthcare system is having a big impact on how businesses treat their employees and potential employees. I was dismayed to have to make hiring decisions based not on who the best candidate for the job was, but who was the cheapest candidate to insure. I was also disappointed when my company was encouraged to hire part-time people instead of full-time people, because we don't have to pay for part-time people's healthcare benefits. And further, I was horrified when during a negotiating meeting with an insurance company, we were told, wink wink, that one of our employees was on a very expensive medication, and it was hinted that if we could figure out who the employee was and get rid of them, we could save tons of money. I haven't had a steady job since the start of the recession when I quit that job, and have been unable to find work in the field I'm professionally trained for. I currently piece together part-time jobs. I officiate soccer, lacrosse, and umpire softball. I also wash dishes part-time. I don't have health insurance, and I haven't been to the doctor in years. This past winter, I developed a really bad cold and fever that lasted for weeks. It probably could have been remedied with just a quick visit to the doctor and some antibiotics. Companies should not have to make hiring decisions based upon medical costs. And people working with multiple low-wage jobs just to survive shouldn't have to be put off getting medical treatment because they can't afford it. Healthcare is a human right, and providing healthcare for all is good for everybody.
Good morning. My name is Koki Giles, and I'm a registered nurse for 35 years. I currently work at Eastern Maine Medical Center in Bangor, Maine. This is National Nurses Week. As registered nurses, we see every day the tragedies that befall the uninsured and underinsured in our society. we hear and see the horrendous impact of health inequality on Mainers. As already said, people are suffering, deciding whether to pay for health care or to feed, clothe, and shelter their families. In the last few years, patients that do enter the hospital for care are far sicker than they would have been had they been able to seek just a doctor. They come in through the ED, have huge costs with no way to pay them. They wait because they don't want their medical bills to bankrupt their families. It is completely unacceptable that in the 21st century, we are among the last of developed countries to have a universal health care system. Just on a personal note, I have a 30-year-old son that's been diabetic since he was 10 years old. He could get insurance where he works, but it would take half of his income, and he would have a $4,000 deductible before anything would be paid for, including his medications. He's always worked, but about 2 months ago, because he does work on his feet, he got a bad foot ulcer that developed into infection of the bone. He was 5 days in the hospital. He's now on 3 weeks out of a 6-week antibiotics. If that doesn't fix the bone infection, he will have to have his foot amputated. As we celebrate Nurses Week, we want to demonstrate our commitment to patients everywhere. We believe health care is a human right.
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now! Thank you, everyone.
Good job, everybody. Hard to call.